What is Pcod? The female reproductive systems of fairies regulate the menstrual cycle and the synthesis of hormones like relaxin, inhibin, and progesterone. Infertility is brought on by the buildup of eggs, which causes the ovary to enlarge and release high amounts of male hormones. A hormonal disorder called Pcod affects 5/10 of women who are of childbearing age 12-45 years. The prevalence of Pcod varies, but between 9 and 22 of Indian women are affected. The percentages in China and Sri Lanka range from 2 to 7. In this disease, a woman's hormones are out of balance, causing a variety of symptoms such as ovulation failure, irregular menstrual cycles, trouble getting pregnant, weight gain, acne, and hirsutism. Untreated Pcod, commonly referred to as polycystic ovarian syndrome, can result in further health issues such as diabetes, obesity, heart disease, and high cholesterol. Pcod can manifest in several ways. Common indications include increased amounts of androgen, male pattern baldness, excessive body and facial hair, and other physical signs of excess male sex hormones may occur. Irregular time frames. Due to the anomaly in the egg's maturation, you can experience irregular periods or a delayed menstrual cycle. Difficulty conceiving as a result of irregular, delayed, or unsuccessful ovulation. Ovulation may be delayed or unsuccessful due to the body's hormonal imbalance, which prevents the follicles from maturing and releasing the egg. This has a significant impact on your menstrual cycle. When women go to the doctor about their failed attempts to become pregnant, Pcod is frequently identified. Severe hair thinning or hair loss. This ailment is also brought on by the body producing more masculine hormones. On the skin, gaining weight. How is Pcod diagnosed? There is no specific test to identify Pcod, but your doctor will review your medical history and conduct a physical examination to determine whether you have the illness. They might then suggest examining the pelvis. Hormone levels are measured via blood testing. Ultrasound to examine the condition of your uterus and ovaries. If Pcod is identified as your condition, your doctor may advise routine exams. Diet to treat Pcod. While there are various lifestyle suggestions for women with Pcod, you are urged to stick to a Pcod diet that is low in fat and high in carbohydrates. This would stop any unexpected spikes in your blood sugar levels and assist you in maintaining a healthy weight. Foods that could be present are natural unprocessed food, spinach, kale, and other leafy vegetables, foods high in fiber, broccoli and cauliflower, nuts and legumes, fish, whole grain, low-fat dairy. Your first aim should be to lower your weight if Pcod is a problem for you. There are several other exercises you might pick from, including high-intensity interval training, cardiovascular workouts, mind-body exercises, strength training, interval training. There is no clear cause for Pcod, however. Early detection or diagnosis of Pcod will be constructive in relieving the symptoms as well as reducing the complications involved. Pcod treatment helps you to manage your concerns including infertility, hirsutism, acne, immature follicles, or obesity. However, specific treatment might involve lifestyle changes or medication. Why is Pcod on the rise these days? More and more women have reported having Pcod during the past 20 years. Nearly 18 to 20 of women in India who are fertile suffer from PCOS. In fact, some gynecologists claim that PCOS is becoming more common in young people. What is causing the increase in PCOS instances is a topic of discussion. One of the main contributing factors is their way of life, which includes excessive stress exposure and activity, unpredictable eating patterns, and inadequate sleep. Obesity, which is a direct outcome of a sedentary lifestyle, is the second most frequent reason.